Yeah. So welcome everyone to the webinar number 35 of the Reclaim Network Plus. So if you're new to this webinar series, so the Network Plus is funded by the UKRI. So there are three councils, EPSRC, NERC, and AHRC. And this network is partnered by the 5 institutions, including Surrey, Bangor, Warwick, UKCEH, and Bath. So So yeah, this is the team of the network who has been giving the technical leadership, and then we got the team which is helping to run the network with Mark and Charlotte. So yeah, so basically this network series we started long back. So as you said that this is the webinar number 35. We usually have it on the first Wednesday of every month between 12:30 and 13:30. Have 2 speakers. Each speaker is speaking around 20 minutes, and then we're taking the question and answers later on. All these webinars are recorded, so you could go to our YouTube channel. So we'll put the link in the chat box, and you can view the previous webinar. So for example, you could see the previous one was on 5th of March. And we got 2 fantastic speakers from UW Bristol and the Zero Carbon Guildford. So, so the network basically has grown quite a lot. When we started with around 40 members to almost around 650 members, and they come across like 40 countries. They got quite a lot of the varied interest, starting from public health and well-being to looking into the economic opportunities and the individual type of the GBGI, with an interest of what sort of the ecosystem services they provide in terms of removing air pollution or improving physical health and well-being and so on. So there has been lots of activities of the Reclaim network. So I'll not go in detail, but you can see the details of the funded projects, the synthesis reviews, the workshops, secondment, and some of the large events. So if you go on to the reclaim-network.org, you can find all these details there. So this is, we introduce something new every webinar. So this is one of the projects which has been developed on the back of the Reclaim Network Plus, so that's called GP Forest Street. So this project is started in January, and it will run for around 30 months. So the whole idea of the project is to kind of regenerate our streets, which really do not have a lot of space, a lot of grey infrastructure, the people living there. So it's a fantastic opportunity to look for innovative green and blue infrastructure type solutions, which could be embedded or integrated actually in those environments, and that can help with the adaptation of the climate change. So you can find more about the project on its website, which is gpforeststreets.org. So today we got 3 fantastic speakers. So the first talk is given by Felicity Harris and David Newton, and they will be they're representing the Portsmouth City Council, and they'll be talking about how you can take actually the grey to green. And then the second talk is by Harriet White, and she will be talking about the NHS Forest. So usually what we do is we take all the question and answers in the end, but since one of our speakers has to go, so we will have the first speakers, and then we'll have the Q&A just after that for another 5 minutes or so. So we would request you all actually to put your question and answers using the Q&A chat box, which is on your screen. And I've got my colleague who is the co-lead on the network, Prof Laurence Jones, and he will be taking over the Q&A session. So so there are a few more things to add. So these webinars are recorded so that we can make them available later on. And if you, as I said, have any questions, please use Q&A chat box. So let me introduce to our the first speakers. The first one is Felicity Harris. She works for Portsmouth City Council. and providing strategic leadership for Council's greening strategy, which focuses on resilient biodiversity and, in fact, effective use of nature-based solutions for equitable access to nature and the benefits from the nature. She spent over 25 years working in the nature, people, healthy space, including as program director for Green Space for Health at the Center for Sustainable Healthcare and head of participation and learning at Plant Life International. So her interest in climate resilience builds on working in international development with a focus on trees and rural livelihoods. She has been engaging with the network for a very long time. She has been a great support, and we really thank and appreciate Felicity to take her time to talk about it. Now we got to the second speaker, which they will sharing the talk, which is David. So as part of the infrastructure services team, so David is responsible for overseeing the design and delivery of cities' cityscape, including highways improvements, major projects, public planning, and planning gain. He's currently collaborating with colleagues across the council to establish a transformational green blue infrastructure development program. So David is an urban designer with a background in community development, who has over 25 years of experience in regeneration and sustainable development. So I think both of these speakers are highly experienced and they've done fantastic work in the area. I'm really looking forward to hear them. So without any further ado, I'm going to pass it on to them. So you guys have 20 minutes. If you can please keep it to time so we can then use the time question answer and before we go on to the second presentation. So over to you. Perfect. Yep.
I think you're on mute.
Thank you very much, Prashant. And thank you to everybody. This afternoon, we're going to be talking a little bit about a process that we've been going through over the last 12 months as we've started to think about how we accelerate green infrastructure into our highways. What we want to touch on is some of the context, so a little bit about Portsmouth as a place, because that has affected the decisions we've been making. We're going to sort of talk about what we've done over the last 12 months, what we've learned, and what we're going to do as a result of our learning, as well as some of the unexpected outcomes that have arisen from our work. So in Portsmouth, we have a vision, which we call Imagine 2040. And there are lots of 6 elements in this vision. So by 2040, we want to be a healthy, happy city. We want to have a thriving economy, and we want to be a green city. And we've defined what we mean by a green city, as you can see to the right of the slide. But I think what we wanted to do was share this slide because for us, this vision, the whole Imagine 2040 has been really important in enabling us to talk about the multiple benefits of green infrastructure. So delivering a green city is supporting with easy travel, is helping a thriving economy, and is supporting all our residents live healthy and happy lives. So a little bit of a context about Portsmouth. On the left, you can see a map, and this map is based on Natural England's GI map, which looks at how close accessible green space is to communities. And you can see that a lot of our communities, so the community is not covered by the blue dots, there's not actually a lot of accessible green space available. Why is that? Well, let's have a look at the context of Portsmouth. So we're on the south coast. We're which means we experience a lot of heat. We're a port city. One of the considerations we're starting to think about is concerns around vector-borne diseases, which means we have discussions in the city about vegetation and about standing water, like preparing ourselves really for vector-borne diseases that may be coming into the city in future years. We're a densely populated city with high levels of deprivation and health inequalities. Air quality is a particular problem in Portsmouth. There are barriers to accessing spaces. You can see this big railway running north to south across the sort of island part of the city. And it can be quite hard to kind of navigate the city and access the green spaces if they're not on your doorstep. And a lot of our population live in high-rise buildings or in rented properties, and so don't have agency, don't have their own green spaces. As a city, a lot of our land is reclaimed. We're low-lying. So when it rains a lot, the water's got nowhere to go. It kind of sits. And we have limited space, both above the ground, but also below the ground, because we've got, in parts of the city, we've got very little soil volume to take water. One of the wonderful things about Portsmouth is that we have a lot of nature, particularly on the east coast of the island. That's absolutely wonderful, but the sites that are important for nature conservation tend to be sites used by visiting birds like geese and waders, and therefore there's quite a lot of restrictions as to the type of green infrastructure you can have on those sites. So in 2023, we published a new greening strategy, and this has sort of enabled a lot of our work to happen. And our greening strategy said we are looking to address issues of inequality. And to do that, we need to think more about how our spaces are multifunctional. There's no places to make new spaces, so we've got to get the most out of the spaces or the green infrastructure assets we've got. And we've actually got to think a little bit harder about getting the right green infrastructure in the right place for the right benefit. That was a very sort of a kind of big picture strategy, and over the last 18 months, as a community of practitioners within the local authority, we've been sort of distilling that and thinking about what that really means, and that's allowed us to think to frame the strategy within the idea of climate resilience and to develop 3 specific goals around resilient biodiversity, the effective use of nature-based solutions, and delivering equity in access to nature and nature benefits. Recognizing that there's limited space for us to work with, as I said, we're driving up our mechanisms are therefore increasing multifunctionality, improving the performance of the GI we do have through how we manage it, and also looking at where there are grey to green opportunities, not green to grey. Sorry, that slide's wrong. Looking at where there are opportunities to grey the green. And a lot of our grey is highways. One of the things that's been really useful for us is the report that came out of the Chartered Institution of Highways and Transport, which talked about the opportunity for green infrastructure in the highways. And as a sort of professional body, sort of seeing this idea that we could be using the highway space in different ways, I think it's been really useful. It sort of feels, okay, that narrative's not just coming from within Portsmouth, it's coming from places external to Portsmouth. So we decided we needed to have a look at what happens in our highways, recognising the important role it could play in delivering green infrastructure. So we set about a journey looking at what is happening in the city now and why, what is not happening and why, what was possible and under what circumstances, and what we have learned from that process. It's been a sort of 9 to 12 month process. We've carried out workshops with internal stakeholders, which Dave's going to talk about. We've interviewed people, we've looked at other local authority settings, developed case studies, and done a lot of literature research. And I'm going to hand over to my colleague Dave now.
Right, thanks very much, Felicity. Yeah, so it was obviously a big challenge, and one of the issues we faced straight off the bat is limited resources, both in terms of finance and officer time. So we were a little bit like, how do we how do we eat the elephant? And obviously it's in small chunks. So we broke things down initially for the study. We knew we had a sort of a moment in time where there was a considerable amount of interest around green infrastructure because of the emergent and then delivered strategy, and that had recently received some political interest. There was interest around sustainable drainage systems because there was an issue in a number of areas on the highway, but also Southern Water, along with the rest of the other water companies, was increasingly being under pressure to sort out their issues with overspills into our waterways, and they were interested in talking about projects within Portsmouth to support that and support nature-based sustainable drainage as a result. And there was a renewed interest, which is one of the reasons I arrived at the authority, there was a renewed interest in the street scene as a whole. Kind of touches on what was mentioned at the outset of this session, that recognizing that streets are not just to enable vehicles to go from A to B. They are the thing that stitches communities together, and they should be a place of a community, and how they are built and what they contain has a huge impact on whether people decide to spend quality time there or just pass through. So we had this moment where there was a lot of interest in all of these things, and we decided we could bring that together and focused on nature-based SADs in the street scene. And we thought, okay, well, how do these things come about if they are going to come about? Let's look at the pipeline. Felicity, if you could do the next slide, please. And so we talked to colleagues, the workshops that Felicity already mentioned. We decided to structure them along this kind of infrastructure life cycle. So this is how we tend to manage grey infrastructure, but thinking of green infrastructure in the same way. So there's a development phase where we come up with ideas and locations and concepts. Then we turn that into a more specific sort of detailed design. And then eventually that becomes the scheme that we actually deliver and construct. And maintenance is then required thereafter. And we were aware just from passing conversations with individuals as we were starting to sort of discover what was of interest around this topic, that there were various sort of issues and that cropped up at each of these stages. And so we wanted to explore those more. So we simply structured a series of workshops for each stage in the process to find out what it would take to change each of those stages to create a nice smooth pipeline for green infrastructure to pass through. If I have the next slide, please, Felicity. So what did we learn from doing that? Well, like I say, we set the context with other research, and issues that came out of those workshops were then explored through further interviews to make sure we had things right, we had it understood correctly, or if we felt there was something we needed to drill down to. And there was loads of good stuff that came out of those conversations. There was loads of interesting, sort of really practical information that came, some of which further highlighted some of the physical constraints that Felicity has talked about, or some of the operational issues that we faced. It seemed relatively fixable. But what we became interested in was the culture around all of this, and what that meant in terms of leadership and engagement, and the way in which people felt able to work on this scheme. So did people who were coming up with ideas in the very first instance to improve a piece of let's call it highway network, but to make a small improvement on the street, put in a zebra crossing, let's say, did they feel able to include as a part of that brief a rain garden or some other, a tree? Just where would that idea have come from? And that's what we explored, that actually the officers that were doing this work were generally really supportive, but because there wasn't actually a broad sense of permission, it was quite ad hoc. It was quite an add-on. It came down to put officers' individual sort of commitment to the topic, and then quite often that would be one of the first things that was sacrificed because of timescales or budget. And because it was ad hoc, and because there was a general intent rather than a specific plan, that also led to inefficiencies. And we had a lot of work to do on our information management as well to help people make decisions, as Felicity was saying, about where it would be the right place to put the right kind of infrastructure for the right reason. And there was, in the face of all this sort of general sense of support, but no specific sort of driver, there was also some resistance from both the community and the politicians that represent that community, because quite often the only it felt like the only place to put some of this stuff was to remove a car parking space and put in a rain garden, a tree, or what have you. And depending on the community, you might have people that had a sort of let's say a sense of an inherent right to the freedom of the city via their car, or you have people facing really challenging situations with multiple low-paid jobs that don't get paid travel time, that just need somewhere to park their car so they can get to work, so they can feed their family. And our great idea would be to give them a tree instead. And so there's a lot of tensions around that we needed to work through. And then either for genuine reason or because of a sort of a defensive reflection, a lot of issues around capital costs and revenue costs for both the build and the maintenance came out of this as well, which we could largely debunk and also help point towards the prospect of other funding mechanisms on the horizon, which was great. But key out of all of this stuff, as I mentioned at the outset, was that we had a cultural phenomenon where there was a general feeling of that it's something we should be doing, but nobody championing it, certainly not from a sort of a senior level, no visible championing of it, although there was stuff going on in the background. And that led to a culture where GBI was seen as a sort of an add-on rather than core to the work that we do. And it seemed that whatever we were talking about at this lower level, that culture was going to wipe it clean if we didn't do something about it. And the old 80s management consultant adage, I used to be one, of culture eats strategy for breakfast was ringing in my ears at the time. Next slide, please. And what we found really interesting from that conversation about culture was that actually those who had most high profile role, should we say, most active role in delivering this stuff, which is sort of represented by the orange line, those who were most interested in the topic, actually felt like they had the least power, and the power represented by the blue line. So a really good example of this is our landscape architects. We're enormously lucky to have our own internal team of landscape architects who can incredibly capable, who can design up this stuff, but they didn't feel that they had the power to do that because they were often challenged. So they required a direct instruction. So what we wanted to do, I'll take the next slide, please, is set about building that consensus, that permission within the organization before we went any further with the detailed stuff. And that's what we've spent the last few months having a good go at, and with some success. So it was all about creating building a sort of a swell of grassroots change. I mean, things already started to happen. Good conversations happened. We've had a tree pit design, standardized design emerge, and a really good cross-organizational conversation happen about that, but at sort of officer level. But we wanted all that work and all that support to be picked up and become a real sort of wave of support once it had a big push from the senior managers. So we have been doing, and there's still more work to do on that, getting buy-in, building the business case. And key to the business case is the point that Felicity made earlier on about the multifunctional nature of GBI actually assisting all those different elements of the vision, of our vision for the city, that has a social aspect, a health aspect, that it not only can help with the carbon and biodiversity, but of course, as was the focus that we were looking on, it was about water management and flood management as well. And that if we could build that business case, at least an understanding of that business case, we could get more people at more senior levels across the whole organization thinking, oh, actually, how might this relate to me? This could actually be a helpful tool. And if you could make this the best tool in the box, then you get more people willing to chip in some money to make this stuff happen. And we came about with this idea that actually the challenge that we face is getting people to prioritize their spend. And if they prioritized it on this and they understood that other people might help them implement this, i.e. by pooling all their money, they might think, well, this is really good value in helping my agenda. So we've been trying to push that kind of concept forward, and both using this language and having this conversation, both with internal colleagues and external partners as well, to get this citywide approach to the agenda. Next slide, please. Thank you very much. The idea being that we recognize that we are on a journey. We've done, I think, good work so far in getting that language used, that understanding about the business case. We do now have much more visible senior support with directors taking responsibility for different elements that all of this relates to, but it is still very much an evolving picture, and we still remain constrained by our resources. So we've moved from having pockets of support and this sort of ad hoc approach within the business, and we've edged ourselves tentatively to what I call opportunistic, either understanding what the opportunity is and having a bit of a better understanding of what we might get out of doing something if we pick the right area, or at least can optimize what we do in that particular area to reflect the issues of that geographical location. And we're just trying to stabilize that, but we that position before we move on and take the next great leap forward, which is somewhat constrained by limited resources. So Felicity has been doing enormously good work recently, herding cats within the organisation, me being one of those, to pull together a bid to support us in that, in terms of nature, towns and cities, to really give us the opportunity of accelerating this work so we can get to a point where we're seeing this as strategic investment for the organisation. And we move from the point where we're using almost abstract numbers about we need X number of trees in the city to actually a much more qualitative approach. And we're thinking about what would this appropriate piece of green infrastructure do to the network city, the city network of green infrastructure, and how can it enhance everything about that local site in which it's put to reflect both the social and ecological and economic issues there present. Thank you.
So I think I could pass it on to Laurence for the Q&A.
So thank you, Felicity and David, for a fantastically inspiring talk. Just a reminder for anyone listening, just to put questions in the Q&A box. I'll start off with a question though for both of you, but it kind of touches on what you were saying, David. That was a really interesting graph showing the sort of perceived power versus interest. And I was kind of wondering how much of that is just perceived power, that people don't feel they have the power to make decisions, versus an actual constraint. So how much of it is in people's heads and how much is a sort of hard constraint that you can't easily change?
I mean, I'll dive in, Felicity, but you welcome your perspective as well, for sure. I felt that it was most of it was conceived rather than actual, because there was a spirit of consent within the organisation predominantly, but there were some genuine challenges in there around the point that I made about resistance to let's say carriageway reallocation, reallocation of space on the carriageway. There were some genuine issues there that had burnt people's fingers, shall we say, that might make them more cautious about putting some of this stuff forward. So we needed to rebuild their trust in the, and we're still, you know, it's not done completely by any stretch of the imagination, but we need to do this piece of work to rebuild their trust in that they do have permission to put this stuff forward, to test its appropriateness and give them the tools to do that, and to support those ideas with a strong case. And that's what we expect, but not only what we expect, as Felicity highlighted at the start of it, that our professional bodies expect as well, that this is a part of the bigger agenda than just Portsmouth. I think we've still got a bit of work to do on the public engagement side of that with some of the crunchier issues, but that's, which we haven't had time to get into here, but that also explains our approach to what we want to do with the next way of moving forward, is to use co-production to sort of build good examples of this work to help with that instance. Felicity, anything you feel from that?
Okay. That leads nicely on to the next question, which is, do you have any placemaking sites where green or blue infrastructure is close to completion or about to start? You know, is there anything about to start or has been happening on the ground yet?
Thank you for that. Thank you for that question. We are lucky in Portsmouth that we, as a local authority, we have, for example, large amounts of social housing land, school sites, and the carriageway. One of the projects that we've been rolling out over the last sort of 18 months has been about sort of greying the green in one of our social housing estates, and that's had our sort of learning from that was actually having a green infrastructure plan for the whole site at the start enabled things to having that vision enabled things to happen. And so that's seen a lot of tree planting in that area, a lot of soft permeable surfaces being introduced. We also have a pipeline of projects around sort of green and grey infrastructure across a number of our school sites, which we've identified as having challenges with both heat in the summer, but also by their very nature, they're very impermeable, so experiencing a lot of surface water flooding. And I think the slide at the beginning of the presentation showed we're starting to see more sort of rain gardens in the high streets, aren't we?
Yeah,
that's
sure.
Dave's domain.
Yeah. So my engineers are keen. They're small wins, and sometimes they are constrained in terms of their designs. But it is being thought about now. You know, just often it's more at the moment about rain-fed planting rather than raised planters, rather than the full-on sort of sustainable drainage systems. But we have put a few in. There was a big highways project where we managed to recently put quite a large scheme in. But I like, one of my favourites is I was just walking over a site with a couple of the guys, and we spotted a drain that was running right by a tree. We just put in a new bit of drain. It was not quite finished yet, and we all looked at it and went, why are we running the water past the tree? I mean, it literally was about double checking what we could about the soil and then just drilling some holes in that bit of drain to actually feed the tree rather than take the water away from it. It's just little things like that. You know, there's plenty of learning in this stuff, and it's nice to see those small changes, but we've got to get more strategic, and that's the next part of the journey, as we've said.
Fantastic. I think we've got time for just a quick answer on one more question. So how are you, or will you, quantify the success of the programs? And I guess that sort of counts success from a social perspective as well as a sort of environmental perspective.
Thank you, Laurence. I think we're taking a sort of holistic picture, and I think it's about we're sort of moving forward with this work. And it's about understanding different categories of success metrics, some of which will be descriptive and some of which will be and kind of more qualitative, and some of which will be quantitative. And I think that's our we've been very busy over the last few months, and kind of that's our next space, really. One of the things we have been doing over the last 12 months is we spent a lot of work on a lot of time developing an urban forest master plan, which has sort of clear descriptors in it. We will be taking that approach more broadly. So definitely we want to quantify the performance and understand the benefits that are being delivered, but also I think there's something about sort of going back to Dave's part of the presentation, understanding how culture and attitudes have changed as well. So I think we're now on that place where we put together those kind of success metrics.
And it might be worth just sorry to cut across you, just very quickly to mention that we're also as a part of this work looking at how we utilize the Healthy Streets Index over sort of a Healthy Streets Plus to enhance the green element of that. So trying to take that, as Felicity said, holistic view.
Thank you both. Then I think we probably ought to move on to the second talk. So I will thank you both Felicity and David. Thank you very much. And I'll hand back to Prashant now to introduce the next speaker.
So thank you very much for the fantastic presentation. So let me take this opportunity to introduce to our next speaker, is Harriet White. She's the Woodland Creation and Tree Planting Project Manager for the NHS Forest. This is a project run by the Green Space for Health team at the Centre for Sustainable Healthcare. Through this role, she has the privilege to enable people to improve their NHS green spaces. She has been able to use my previous her previous experience running conservation and tree planting projects in East Anglia to support applicants with their green space improvements. Harriet have been linked with the network for a long time as well. So we really have a pleasure for having you here today, and looking forward to listening to you. Over to you.
Thank you, Prashant. Is that all right? Can you see those? Yeah, I think so. Great. Thank you for having me today. So I'm going to talk about the tree planting project mainly, which I've been working on for the last 2 planting seasons. We actually finished on Monday, so it's quite fresh. But I'm going to be talking about why it's critical to plant trees, especially in an NHS healthcare context. And I will also talk about some of our other projects. So we're a small team, the Green Spaces team, but thanks to some large-scale planting grants, myself and my colleague have been able to focus entirely on tree planting for the last 2 seasons. So just starting on that, green spaces are one of our most neglected healthcare resources, health resources, and there's a great fundamental role that nature plays in supporting mental and physical health. There's a huge list of research now, but some of the things that it can help with is improving stress levels, cognitive development, post-operative recovery. The list is really long. There's also evidence that, well, we know that there's considerable inequalities in the social spatial distribution of tree canopy across the UK, and this will be demonstrated. I'll talk about the Tree Equity School later on. But we see healthcare sites as being very well situated. They're often in urban or semi-urban areas and are worked at and used by a representative cross-section of society. So if we make these green spaces really good quality, they have the potential to be equigenic, which means that they can help with that kind of health gap between different socioeconomic groups. And also, I think this is in the Darcy report, but it's been calculated that the NHS could save an estimated 2.1 billion every year in treatment costs if everyone had access to good quality green space. So we're thinking, we need to make these good quality green spaces around our hospitals. So some of these little poster things are from our kind of campaign from the last 3 years, really. So our main kind of themes when working with green estates teams is to get them to think about how trees can be used as a barrier between people and polluted air. A lot of healthcare sites planting trees and hedges for this purpose, along roads, around car parks, these kind of things. Trees can also be planted aside hospital buildings to reduce indoor temperatures. A lot of the NHS properties are quite outdated, and there's been reports on some overheating in some of these hospitals. So considering the capacity of trees to help reduce indoor temperatures, as well as that urban heat island effect, is really valuable. And then lastly, trees are obviously brilliant for staff and patients to sit amongst and take their breaks within. So thinking about those health benefits for the people using the site. So I was really glad to find this example when talking to the estate manager here. So this is Tickhill Road Hospital, which is in Doncaster, and they were one of the first sites to plant trees with the NHS Forest back in 2009. So if you look at the security camera on the post, you can see just how much these trees have grown and how the tree line has changed. So this was an expansion project of the existing ancient woodland, and yeah, it's really great to see the 15-year difference that planting trees can make. So well, yeah, between 2009 and 2023, the NHS Forest planted 105,000 trees in or near NHS sites. And then in the last 2 years, we've planted an additional 52,000, almost 53,000. So we've really kind of ramped up the tree planting. And these are just some examples. One on the left is an ambulance station, and can't remember where the one on the right is, but it's orchard planting, and it's, you know, between a car park and a road. So quite interesting uses of spaces here. So we've supplied trees to 175 different trusts, some with like multiple sites within these trusts, and a lot of these sites taking trees from both seasons. So we've been supplying a lot of different projects, and the majority of these sites are approaching us because they previously worked with us, and they've heard about the NHS Forest or Centre for Sustainable Healthcare. But we also reached out to some sites specifically because of their tree equity score. So, for example, this is Leicester General Hospital, so tree equity score is based on looking at some indices which are mentioned in that bottom right hand corner. So it looks at heat disparity, age, health inequalities, and it also looks at canopy cover in that specific area. And it calculates a tree equity score. And so where the hospital is located has a tree equity score of 78, which is actually quite low. As you can see, it's a priority area for improving canopy cover. So we worked with Leicester. Luckily, my colleague is right up the road, so he was able to design a planting scheme with them, which was really appropriate. So this is before and after of one of the areas within the hospital. Behind where the photographer is, there's a massive car park, and this is an area of this is a field that wasn't made into a car park because it was a really boggy field. So they've done some kind of appropriate planting there, which is going to look incredible in 15 years' time, and increase the tree equity score of this area as well. So we supplied trees to a huge range of different sites. Some, like Leicester General, have a bit more space, but the majority of sites, have just pockets of green space. So we offered thematic bundles of trees starting at 10 trees. We also had fruit trees and, as I mentioned, the larger woodland creation scheme. But this is a before and after of Southmead Hospital in Bristol. They planted some fruit trees with us, and they have a ranger there who gave some really lovely feedback, saying that it was a really huge success and they're hoping to plant lots more trees with us. Planting the fruit trees got people involved talking about the other potentials for this site, and they're now applying for funding to start up a nature-based community food hub, and are looking for to create an allotment space and seating, and to run a bunch of engagement sessions to utilise this space, both for the staff and patients, but also the wider community. So that's just really a lovely example of how it can kind of, get things going in the kind of green space world. As we were working quite remotely, we decided to create quite a lot of resources because we couldn't go and visit all these sites, unfortunately. So we created a whole host of resources, including myth busting. This is to kind of arm, I suppose, estates team with information which they could take to management to be like, planting trees isn't necessarily going to increase the pollen count. We can plant smartly so that we don't do that, and right tree, right place. And we also created a lot of guides specific to planting on healthcare sites, including planting and planning and maintaining orchards and healthcare sites. Orchards, as you kind of guessed from the last slides, are quite a good starting point for people to think about other things, and it's got a good social cultural value. So I also created a seasonal health calendar to get people to engage with those kind of trees. We also started a volunteer matchmaking service. So we found that some sites required volunteers, both for the tree planting, but also for wider green space project and for and to help maintain those trees that were planted. So we've started that resource as well. So planting in public land. So I've shown you some really lovely photos, but a lot of the photos are kind of planting at the edges. So this is planting at Leeds, an ambulance station in Leeds. And as you can see, they're covering up a really beautiful fence. So a lot of the planting happens hedging is really vital for healthcare sites. I think it's, you know, it's so good for air filtration and creating zoned areas and barriers and just adding a bit of life and biodiversity to the sites. So I would consider that hedging should be uncapped for future grants that we do. It also we had a bit of a the interpretation of what the NHS estate is a little bit vague, and unfortunately, like our grant was tied to NHS estate being owned by NHS, which in reality a lot of NHS services are provided in owned buildings that aren't owned by the NHS. So kind of a bit more flexibility about that definition. Maintenance, obviously, the estates teams are brilliant, but we would love to see maintenance included within future grants. Biodiversity net gain is really important for NHS estate, and where development is occurring, they are reserving those green spaces to offset that loss, the biodiversity that's lost through development. So future trees we would hope would be able to fit within that. And then also, lastly, burden of evidence. So we had sites sending photos before and after. They sent GPS coordinates, maps, all sorts of information so we could glean where they were planting. But we realised it was quite a lot of evidence for people who were just planting 10 trees. So maybe we'd need to think about a more proportionate scale of evidence needed. But yeah, it was really fantastic. Loads of wonderful pictures of people having great days out. Lots of conversations sparked, and yeah, fantastic outcome. I'm just going to touch a little bit more on what else we do at the NHS Forest. So historically, we've had Green Health Routes, which is a project which supports sites to map their walking routes in and around the site, so that can enable staff and patients to use these green routes so they can get out into nature. We've got a really active NHS Forest network, which is a network of people on NHS sites who've done great green space work. We are involved in research and policy work. We've helped sites map, and we've provided ecological advice to some sites. We have a conference we'll have it in October this year, I think, which is fantastic, and we have awards as part of that. Tree equity scores I mentioned, tree planting, and then nature recovery ranges. So nature recovery ranges are situated within a trust, and they are kind of a conduit between the green space and the staff and patients, and they really are there to help facilitate the use of the green space in the best way. So we've got a ranger in Liverpool, Nick, who is helping improve the site in Aintree so beautifully. We went up the other week, and he runs conservation work in the local woodland. He's done loads of tree planting, and he's enabling staff to use the space. So this is a few things from our Space to Breathe report, which kind of indicate how green space is being used. So holding meetings outside, taking part in organised activities, having a walk at lunch. And the ranger really, I think, is situated in sites to enable more of this kind of activity. And we are currently recruiting 3 nature recovery rangers and a senior ranger, and deadlines on Sunday, I believe. And if I've got time, I'll just play a quick, I won't play all of this, but I'll play a bit of this about our ranger project. That work? close that now because I think we're running a bit short on time. But yeah, that's everything from me. I just want to say thank you and share my favourite photo. So this is from, we did a photography competition last year, and this picture was taken at in South Tottenham in their Peace Garden, and it was during a Connection with Nature walk that they were running, and I just think it's really lovely and wild and wonderful. I will put my email in the chat if anyone wants to connect, but yeah, thank you.
Oh, brilliant, Harriet. Yeah, thank you very much. I'm going to pass on to Laurence for the Q&A session.
Thank you, Harriet. And just a reminder to put questions in the Q&A if you've got any for Harriet. So I'll start off. Harriet, you kind of, there's a lot of fantastic work you've been doing, and I'm just sort of wondering what the sort of unofficial responses have been from people. So, you know, from members of the public, from members of NHS staff, you know, what are some of the sort of verbal anecdotes you can share about this kind of work?
Yeah, I mean, it's been really great. We get passed on to a lot, you know, a lot of comms that's happening internally. It's, yeah, really, I think tree planting is a really good starting point for people to start thinking about how the green space could and should be used. I shared that kind of orchard example in Bristol, so that's very kind of common, really. I think tree planting, the events themselves are like always really jolly, and yeah, I think they're just a very cohesive starting point. People can connect with people who they maybe haven't met before, who are on the same page and want to. It's a good way to kind of galvanize energy about future green space projects. So yeah, yeah.
Do patients use the spaces at all, other than
yeah,
through organised events? Do sort of people use them spontaneously, do you think?
Yeah, it's incredibly varied. Some of the planting events have been co-organised with patients, for patients, and so, for example, in Homerton Hospital, the kind of OT there, she's planted lots of fruit trees, which she's worked with her stroke patients to decide what varieties they'd like to choose. So it can be kind of as tailored as wanted, really, and we've been able to supply a huge variety of trees to kind of accommodate the different needs of the sites, and if they, yeah, so very, very mixed.
What's your kind of vision on how this will, you know, the work you do and how it will progress for the next 5 years? What are your thoughts on?
Yeah, I think
where you would want to see it go.
I think similar to, I mean, I heard the word David and Felicity were saying about thinking about qualitative rather than quantitative, and I think that we've got a few funding bids in the pipeline which are going to be focused with a few hospital trusts in a more like holistic way, rather than trees and numbers in the ground, thinking about wider kind of green and blue infrastructure that we can work on particular sites on, and thinking about climate change, adaptability of these sites, as well as that kind of green health routes, kind of a whole picture, looking at and working with kind of a handful of sites at a time. That's kind of one avenue we're taking. The range of projects really developing. You know, we're going to be able to cover, I think it's 30, you know, there's a lot of was it 36 different sites amongst those different trusts that the ranges will cover. So I think really helping people can have that nature connection is a huge direction that we're going to be going in as well. But we're always going to be having trees because they're kind of a fundamental starting point.
And has the private health sector shown an interest in this kind of greening initiatives?
We haven't worked with the private health initiative, sector so much, but they definitely, I think, have the same goals. It would be interesting to work with them, to be honest, in the future, because I'm sure they've got lots of green space as well that could benefit from all sorts of work.
Okay. Fantastic. Well, thank you very much. I don't think we've got any more questions. So just checking chat and Q&A. And thanks, Harriet, for putting your contact details in the chat as well. If we've got no more questions, I will pass back to Prashant to close the webinar. Thank you.
So thank you very much. So before we go on further, I think I would like to thank both or three of our fantastic speakers and our Q&A chair for facilitating the discussions. So just to close, we got our upcoming webinar. So that is going to be on 7th of May, the same time. So this is the first Wednesday of the month. And we got two researchers will be talking about the heat cool program, which is from the GCARE team at the University of Surrey. And then we got our co-investigator, the co-lead from the University of Warwick, Dr. Neria Calavilo. So she will be talking about GBGI and the related social sciences. So it's going to be very interesting presentations. So we will welcome you to join the next webinar and possibly put that time in your diaries. Just to close this, so I would like to again invite you, if you're not a member of the network, so please go on to the reclaim-network.org and join the network for free. So it's a small form and you will start getting the information. If you have any queries or if you wanted to present into the webinar series or you have someone else you think that they could be a great speaker, so please write to us, either one of us to us directly or to info@reclaim-network.org. We are also present on the X and LinkedIn, so please follow us for the further updates. So with that, I'd like to thank all the contributors, all the audience, and our team who has been working hard in the background, and obviously the funders actually who made us, offered us the opportunity to run this network. So thank you very much and look forward to see you in the next webinar. Bye.
Thank you. Bye.
Thank you.